it. I was cleaning Molly's room and I found a condom.
Is it used?
I'm not sure. Like, is our daughter having sex?
Okay, I think we need to call Nurse Kelly.
Right away.
Okay.
Hello, Kelly Brown, registered nurse. How can I help you?
Nurse Kelly, it's Tina.
Let's talk about you and me. Let's talk about all the good things and the bad things that may be. Let's talk about sex.
Good afternoon, Helen and Tina. How are you today?
Hi, Kelly. We're good.
We're good, thank you.
Excellent. It's so good to see you guys again. Just so you know, everything that we discussed today will be confidential. I'll take a couple notes for our records, but that will be it if that's okay with you.
That's great. Yeah, that sounds good. Thank you.
On the phone, you told me you found a condom in Molly's room. Can you tell me more about that?
Well, I was just going in to get her laundry and I just found it on the floor.
I can definitely understand why that would be a little alarming. What are your concerns?
We haven't talked to her about sex yet and we don't know why she had it.
So what have you talked to her about? What does she know?
We've talked to her about her period and just kind of general things about her own body.
That's great. That's a great start. So this is definitely a good opportunity for Molly's learning. How did it go talking to her about her period?
She was really receptive and came to us with any other questions she had.
Excellent. I'm glad to know that you guys have established clear communication. Has she exhibited any or disclosed any sexual interests towards others?
Oh, she had that one boy she liked.
What are your goals then for Molly's sexual education?
We just want her to have a positive outlook and a positive sexual education.
Yeah, we want it to be really inclusive and holistic.
Those are excellent goals. Do you feel comfortable talking to her about sex and answering any questions she might have?
Won't talking to her about it just encourage her to want to have sex?
Yeah, we're just concerned she's too young.
I totally understand your concern. Lots of people feel that way. However, educating her doesn't necessarily mean she'll seek sex. It will just properly prepare her for when she decides that she's ready. What questions do you guys have?
We'd like to talk with her about sex, we just don't know how to start that conversation.
It can be an awkward topic to bring up. But addressing that you found the condom and informing her that you know that she had one would be a good opportunity to start. And then you could ask her what she knows about sex and find out what terms that she's familiar with so that you can relate to her better.
Along with that, we really want to have a positive focus on sexuality and her sexual experiences, and we're not quite sure how to emphasize that with her.
Yeah, so I think setting a foundation of a positive body image and encouraging her to explore her body and get to know herself and her own skin would be very important. And to help her develop her positive body image, you guys could try to demonstrate positivity with your own body images as well.
That's definitely something I struggle with a bit.
And Molly could definitely mimic that behavior. Encourage her to find things that she loves about herself and then participate in that with her.
I think we can do that.
You mentioned having her explore herself. Now I know when I was in school there was a lot of rumors about masturbation and it was viewed in a very negative light. We want her, again, to have a positive view on that. We think that's important for her to feel like she can do that and it's okay. How do we go about that?
It's definitely important just for masturbation to explore yourself, get to know your body, and find out what you're comfortable with. So I think the best approach would just be normalizing masturbation. Let her know that it's totally healthy for her to explore her body and encourage her to find out what she's comfortable with.
With wanting her to be comfortable, we also don't want her to feel pressured into sex. We don't want her to be taken advantage of because of her age. So how can we help her understand consent?
That is a valid concern. Do you feel prepared to educate her on consent?
Well, we know about no means no. Is that still okay?
That's a great start. In addition to no means no, we've moved towards yes means yes, which just provides an active verbal consent. In addition to that, Molly needs to know that she's in control of her own body and she controls what happens to it. And it's important for her to know that she has to respect other people's wishes for their personal bodies as well.
So the addition of yes means yes just clarifies a verbal consent. Is that right?
Yes. Based on everything we've discussed, you may also want to consider informing her about protection.
Well, seeing as we found the condom in her room, that's probably a good idea.
It's a good sign that she has a condom. If she is sexually active, it means she has access to protection. You both have to judge, of course, once you talk to her if she's ready for protection methods now, or if that's maybe something you just encourage her to come to you for when she's ready or if she has questions.
Okay.
I can provide you with some resources on current effective protection today, and then you can use those as you see appropriately.
Thank you.
Of course. Do you guys have any additional questions?
No, I think we feel a lot better.
Yeah, thank you so much.
Of course, and feel free to contact me if anything else comes up. It was great talking to you guys again.
Thanks, Kelly.
As well.
Good to see you.